evening. Sorry about the slight delay in getting started. We seem to be running more than one Teams meeting, but not very successfully. So we'll try and iron that out for the next meeting. And thank you very much to those of you who come along in person, which I have to say, I think it's nice when we can have a meeting in person, but I apologise, and I will apologise to those people who tried to log on tonight through the Teams link. It hasn't worked in terms of getting people who tried to log into that into this room virtually. So welcome to this meeting of the MedChi on Wednesday 12th November. We've had one apology for absence from Jeff Holman. The minutes of the last meeting are on the website and can be viewed there. Upcoming social events, we have the tour of the MedChi book collection on Friday of this week. I think 3 spaces still left for that tour, is that correct? 2 or 3 spaces still left, and so that's at 10:30 till 12 midday. If anyone is free and wants to come along to that, you can see how to get onto that by going to the website. And the Glass Fusion workshop, which is a week on Saturday the 22nd November. Are there still places left on that as well? Yep. So a chance to make some Christmas decorations. And our Burns Supper, which will be on Friday, sorry, thank you, Mrs. MacArthur. Friday, the 30th of January, 2026. £35 to come and dance and drink as much whiskey and eat as much haggis as you like. So please come along and enjoy yourselves. Our next meeting, which is the 3rd of December, we welcome Professor Nick Maynard to talk about his time spent in Gaza over the last 20 years. We were going to have an elective report tonight from Tanzania by Chloe Weinstock, who was one of our elective bursary award winners, and she was successfully online on my phone, but not in this room on the Teams meeting here. So we'll do it again another night, and she's very grateful to us for the award of £500 that she had, so we'll forward that on to her. So without further ado, tonight's talk, which is entitled Sea Legs, Life and Surgery on Board the Mersey Ships, is going to be given by Mrs. Rachel Buckingham, who's a consultant paediatric orthopaedic surgeon in Oxford since 2007, is that right? And was from a medical family. Your father was a surgeon, is that right? But your real inspiration was your grandmother, who I read in one of the Mersey Ships articles was a young doctor in the 1920s, which was unusual enough in itself to qualify as a female doctor in the 1920s, but even more unusually headed off as a medical missionary to India to treat people with leprosy. And I think you, from what I understand, you found that a very inspiring thing, and that has led you in your own life to do a lot of work abroad. Mersey Ships, I knew a bit about, I'd heard a bit about them before. They're a faith-based international development organisation which deploys hospital ships to some of the poorest countries in the world. They founded in 1978, they've been to more than 55 countries, and they've delivered £1.3 billion worth of care in those countries completely for free. And their aim is not just to go there and do life-changing procedures, which I'm sure you're going to tell us about, but to improve the delivery of healthcare in those countries as well for the better. So there's the immediate effect, and there's hopefully the effect that comes afterwards. And I think that's amazing work. And really looking forward to hearing what you've got to tell us about the work that you've been doing with them. So, Mrs. Rachel Buckingham. A little bit as well.
Yes, that probably would be good.
Can you see if we go to that setting?
Yeah, that's fine for me. Yeah, that's absolutely fine. Good, brilliant. Good evening, everybody, and thank you very much for. Can you all hear me first of all? Yes. Thank you very much for the invitation. It's always a delight to talk about Mersey Ships, so I always jump at any opportunity to do this. So this is a little girl called Fudia, 10 years old. She's got something called Blount's disease, so has very crooked legs. And I want you just to imagine that you have a child like her, and there's nobody in your country, there's no surgeon in your country that can treat her. And even if there was, you would not be able to afford it. And then you go along to a hospital begging for help, and what they say to you is, well, all you need to do is wait for Mersey Ships. Wait for this big hospital ship to turn up, and they will treat your daughter for free. So what is Mersey Ships? So as Donald mentioned, it's a Christian charity that owns the 2 largest non-governmental hospital ships in the world, and we provide surgery free of charge to some of the poorest countries in the world, and they're specifically for surgery, not for other medical conditions. So why is this necessary? Well, 2 out of 3 people worldwide lack access to safe and affordable surgery. And in fact, in sub-Saharan Africa, that figure is 93%. So that equates to almost 1/3 of people worldwide die because they don't get access to safe or timely surgery. That is more than 3 times the number that die from malaria, AIDS or TB combined. That's 17 million people per year. And I guess really the root of this whole problem is poverty. Poverty of individuals and poverty of the countries that those individuals live in. And in the 1990s, the World Bank asked the question, what is poverty? And they asked this to 60,000 people from low and middle income countries. And I'll tell you a little bit about what the outcome of that was. They published a series of 3 volumes of books called Voices of the Poor as a result of that survey. But have a little think about what you think poverty is. And we'll come back to that at the end. So back to Mercy ships. These are the 2 ships. Hopefully does that work, the laser? Yeah, here we go. So this is the Africa Mercy, which is the older of the 2 ships. The Africa Mercy has 5 operating theatres on board. The Global Mercy has 6 operating theatres, and is quite a bit bigger and is fairly new. It's about 4 years old now. So at the invitation of the host nation, the government of the host nation, Mercy ships will go and dock for 10 months. They've done a huge amount of preparation work before they even get there, selecting patients and working with the government and with local healthcare providers to identify patients that may be able to benefit from the surgery. Then they go and they're there for 10 months, do all of the surgeries. The ship then leaves, but leaves a team of people behind to continue any follow-up, etc., that might be needed. Each one of these ships is actually really like a little floating village. So on board will be a cafe, a restaurant, a shop, a bank, a hairdresser's, a school, and obviously a hospital. But we're entirely self-contained and self-sufficient, except that the host nation will provide water and fuel and waste disposal, although we also have an incinerator on board as well for all of the medical waste. So how does it run? Well, it's run by volunteers, the crew, and they come from all over the world, so from 60 different countries worldwide. It's truly international. I mentioned that it is a Christian charity. A lot of people who volunteer with Mercy ships are Christians, but certainly by no means everybody. And anybody is welcome, people of no faith or none. It's a truly welcoming organisation. And we work in places that are predominantly Muslim very often, and we're welcomed with open arms. And we employ a lot of day crew who will come and work as translators. So those are local people, and obviously they may have different faiths. But I also make no apology for the fact, because I think the Christian faith is the thing that is the kind of glue that holds this organisation together, and it's been going for quite a long time now. So obviously something about it works. Oops. So the aims of Mercy ships are to reduce the surgical backlog in the country, to mentor and train local healthcare professionals. So I always have a local surgeon working with me and who will stay on the ship actually for longer than I do. They're there for this sort of whole orthopaedic block. So that's a really important part of the work that we do. And then we also do some work to renovate and improve local healthcare facilities as well. And so we provide a number of different types of surgery. We can't do everything, so we pick very carefully what we will do. You've got to choose something that you can treat within the time frame that the ship is there. So maxillofacial, plastic, orthopedics, obstetric fistula, general surgery, ophthalmic, dental, and really importantly, palliative care, because sometimes we have patients who come who have some inoperable malignancy. So we have a whole palliative care service for them as well. So before I tell you too much about the orthopaedics, which is what I do, I'll tell you about some of the other specialties. Mercy Ships is actually really famous for its maxillofacial surgery, and that's because we've had a surgeon called Gary Parker who has lived and worked on the ship for about 36 years and brought up his family on board. And has actually needed to invent several operations to deal with some of the stuff that he's come across. But this is one of the patients that he operated on called Sambani, and he'd had this tumour for over 30 years and it really defined his life. He couldn't do anything, he was exhausted all the time and was just waiting to die. And it took several of his friends 2 days to carry him to the nearest road where he could get into a taxi to come to the ship. We don't allow that to happen anymore. We now send vehicles out to go and collect people so that they don't incur any cost in actually getting to us. But he came to the ship and he had a 14-hour operation. He needed 10 units of blood. And there's not much room on a ship. We're really tight for space. So just have a little think about where our blood bank is. How do we store that kind of amount of blood for people? I'll tell you about his outcome later. So I was fortunate actually last year. Max Facs were a little bit short of staff and I had a little bit of free time, so I got to go and actually assist with a couple of Max Facs operations. This is Manjit, she's a Scottish surgeon, and she allowed me to wield a mallet, so I felt quite at home helping with the Max Facs surgery. And what I learned about maxillofacial surgeons is that they see a fibula and they think potential mandible. I thought the fibula was our territory, but it seems that the Max Facs surgeons enjoy that sort of thing as well. These are ladies who have had obstetric fistula repairs. So that's another big part of Mercy Ship's work. They're often ostracised. So they come on board, they have their surgery, they're then given a new set of clothes. We have a big party for them when they leave the ship, and then they're taken and reintegrated back into their villages, finally dry. These are 3 little kids. Their mother, Amina, had congenital cataracts. And in 2001, when she was 13 years old, she was operated on the anastasis, which was one of the previous Mercy Ships, and had her sight restored. Then, when she heard the ship was coming back, she led her 3 blind children to the ship, following along one after the other. They would hold on to each other and she would lead them along, and she took them to the ship, and they all had their surgery on the same day, and had their given the gift of sight. So it almost makes me want to be an ophthalmic surgeon. But then I wouldn't get to do cool operations like these. So these are 2 twins, identical twins, called Aseno and Asan, And they kept jumping in and out of each other's beds, so we had to colour code them. So one became blue and one was green, and that's them after their surgery to straighten their legs. This is a chap called Ulrich, who was operated on by my predecessor, a chap called Frank Hayden, who you saw in the previous picture. Actually, he had what we think probably was a congenital knee dislocation that had never been treated. He was a very withdrawn child, and finally was able to look at the world from an upright position. Some children just need some tendon transfers. But most of the children that I operate on have bent legs. And for most of them, it's either rickets or it's something called Blount's disease, which you may well remember about, but it's when the top of the tibia stops growing on the medial side. So you get these huge varus knee deformities, but also sort of rotational deformity as well. So that's an AP of the knee, but it's a lateral view of the ankle joint. So there's a twist in the bone as well. So let's think about the patient journey. This is a lady who's got a little boy called Amadou. He happened to be the very first patient who had surgery on the Global Mercy ship when it was brand new. And he had rickets. So I want you he's 4 years old. I want you to imagine being his mother. And you can see that his legs are getting more and more bent. And he's also complaining of some discomfort and some pain. You might have spent some money trying to get some treatment for him, and that's thrown you into even more poverty. And you know of people who have tried all sorts of things like digging a hole and making their kids stand in it for 2 hours a day, which is what some of our patients do, just to try and see if that will make their legs straight. And you know that over time it's going to get worse because you've seen other kids like that as well. That's quite a desperate situation. You think it might be because he's been cursed or it's somehow your fault because you don't understand what's caused it. But then you hear about mercy ships and you take him along with a glimmer of hope to the patient selection day. And you're told by somebody there that we might be able to help him. And so a few months later, you're picked up in a Mercy Ships Land Rover and you're taken to something called the Hope Centre, which stands for Hospital Outpatients Extension. And that's a building on land that Mercy Ships hires and renovates ahead of time. That becomes a place where patients throughout the country can come and get their nutrition improved before their surgery. And then once they're medically fit for discharge from the ship, they go back there for their rehabilitation afterwards. Now imagine that you're Amadou. You've never seen the sea before. You've certainly never seen a ship. And you're taken to the ship by your mother. And you see this bunch of strange-looking people who speak in a funny language to your mum. And the next day, you're taken onto the ship for a sleepover. And that's kind of quite fun because there's loads of really cool toys to play with on the brand new shiny ward. But then this strange-looking woman has a really long, boring chat to your mother when you really want to be playing with your new ball. The next day, you're given some medicine to make you go really, really sleepy. And you're carried into something called the OR. And suddenly everything goes dark. And the surgeon washes her hands for a really long time and then does some surgery to straighten your legs. And whilst you're asleep, this is what happens. Actually, these are not your legs. Your legs are not quite as bad as that, but they might have become as bad as that had they been left. Oh, there we go. And afterwards, the whole team celebrates. Back on the ward, you're in a bed, And underneath your bed is a bed for your mum to sleep in, and she stays with you the whole time. It's a bit boring though, you have to stay in bed for a little while. And then they start trying to make you walk. And when you're well enough, you're allowed out onto the veranda to play, and you make some friends with other children who have by now also had their surgery as well. And then you get to go back to the Hope Centre, where you still continue to walk with these little frames that have been made by the ship's carpenter. And what about your mum? Well, you notice that she smiles a lot more now. So back to the little girl, Fidia. This was Fidia walking. And this is her after her surgery. But it's not really just about straightening legs. Actually, what happens with these children during that the treatment process and the rehabilitation is really a lot more profound than just straightening their legs. And I'm going to just show you a little video, which we just need to sort the sound out on it. Very good.
This one stay there. The very first day when they born am. Well, I know they feel fine, but I will get the belief to say if life day, we must meet up. God, you know, say yes, must come. Fudia and Papa died 2019. They belong there with me before and Mama died. Because when Mama come when the Papa died, we go by the Salah. So now we all with Mama and Ukaya and I will be there. So you be ready for go now, and the third left giving Fudia. The school where we go inside and born now, but when Kaya, the first school where I put them, the company they want to reform. So it make and not begin go school again. I put them there, I send out their school back, and the same thing. So even when they go back now, come out, and that's what they back them tell me. They say, well, doctor not even go attend to them. Lord wait until March shift come. So now they make inside the gang. So I don't count now 6 years. They don't deal with me now.
I think Fudia's life has been tough. Fudia has a challenging family situation in which she has lost her parents and she is raised by other family members. So for a part, she might have been grieving for the loss of her parents and maybe grieving for the fact that she was not a normal child. She was not a happy child that you're supposed to be for her age. And sometimes even children with the same deformity as her, you can still see some joy in their eyes. And I felt with Fudia that for her, life has really been a struggle up to this point.
Fudia's legs are so deformed that her ability to walk is really limited. Her feet really point inside 90 degrees. That limits the amount that she can walk. She's always limiting the activities that she does with other people because she's ashamed and not only she cannot walk but she socially is not interacting like other children. So hopefully by making her legs straighter, putting her feet pointed forward, she will also open her social skills and her heart. So it's a big surgery. She's going to be under general anesthetic for many hours and she's going to have long bed casts for many weeks. So it'll be a long process. It's a big commitment from her side as well to rehabilitate and learn to walk again with your feet pointing in the right direction.
There's something about her when she experienced some things that you can really say like, wow, this girl had to fight for her life.
Well, after almost 4 weeks of being in the bed and being in the chair, Fudia today can do her first steps with the walker. We are all very excited. We're all Fudia fans! Yes. Woo. Okay, small.
It's beautiful. It's a blessing to be able to see a life change so much from a child that has had pain in her eyes. Not even when she had physical pain, she just sometimes had pain in her eyes because she went through stuff. And then now to see her and to come up to her and you hear her little giggles and the joy in her eyes, it's been everything.
This girl, she's got energy, she's got life, she's got determination. She's proved herself with resilience time and time again. You could say Fujian's name on the ship and almost everybody will know who you're talking about. And that's a testament to how she brought people together and how she smiled. Yeah, it's those changes that are the most tangible. I mean, you can look at a picture and see these beautiful straight legs, but for me, what stands out is her affect in her face. She was carrying a lot before, and you can see she's light, she's free, and I think she's going places.
It's not clicking on. There we go. Okay. So, how do you make legs like these straight? I'm going to just give you a really quick orthopaedic lesson. Have we got any orthopaedic surgeons here? Not sure that we have. It's carpentry. So, essentially, what we do is, because the tibia is not growing here, we stop it growing here as well, so it can't get any worse. And then we have to lift up the tibial plateau on this side and put a bit of bone graft under there. But then we've got to sort out the fact that the leg is completely twisted and still completely bent. So this is a little plasticine model to show you how we do it. So there's a little piece of fibula. Oops. There's a little piece of fibula having been taken out. Then make a transverse cut across the top of the tibia and move on. There we go. And then make a little kind of triangular cut in the distal tibia here, and then we dock this corner into that little notch. So it looks, oops. How did I go on so many? So it looks like that. And radiographically it looks like that. So that's a piece of fibula which is now sat under the tibial plateau, which has been lifted up to restore that. And then that's that sort of notch cut there. And then we fix it all with wires. We don't use tons of metal because of the risk of infection, and if you're leaving metal in people, if that ever needs to come out and they don't have the right screwdrivers or something, that's a real pain. So the wires are temporary, and then we rely on plaster casts. We get them walking fairly quickly, actually normally a bit quicker than Fidia did. We normally get them up really within sort of 1 to 2 weeks, get some check x-rays, and then we can tweak it with cast wedging and things to get it a little bit better aligned if it needs that. And then they eventually come out of plaster, and then they have several weeks of intense therapy. We also give them a supply of vitamin D and calcium, which in fact they're given even before they come to the ship. At patient selection, they're started on that. And then they have their surgery, and then we give them a year's supply afterwards, as well as loads of education about nutrition. Less important for Blount's disease, but certainly for rickets. And yeah, so that's Fudia's post-op X-rays there. And there she is. So what about my journey with Mercy Ships? Well, I arrived one evening back in 2019. My kids had just about left home, and I thought this is a good time to do something new and exciting. So I just turned up and, well, not just turned, I applied and volunteered for a couple of weeks. The great thing about Mercy Ships is they always put you with another surgeon. So there's always two consultants working together, and one of them has always done it before. So you don't turn up as a new person and are just kind of thrown in the deep end. So I worked with this gentleman here, Frank Hayden, who'd been doing Mercy Ships for the previous 10 years, who taught me some of these techniques that we don't necessarily use in the UK, because we don't see deformities like that in the UK. And I thought, this is brilliant, I want to come back, but then COVID happened. Yeah, so I did come back eventually in 2022. So my first trip was Senegal, 2019, then came back in 2022, and at that point I was asked if I would take over from Frank Hayden as the lead orthopaedic surgeon for Mercy Ships, which I did. So since then, I've been back again to Senegal. That's when the new ship started. I had the immense privilege of doing that very first operation on a brand new ship. Imagine that, and a brand new operating theatre. All of your kit is shiny and new and sharp. I think very few people are ever in that situation where they get completely brand new everything for an operation. So that was quite amazing, really. And then I've been to Sierra Leone a couple of times, and I've been to Madagascar a couple of times. So essentially what I do now, because there are two ships, is I go twice a year, once to each ship. We don't run orthopaedics for the whole 10-month block that the field service that the ship is there, because we wouldn't have time to do the rehabilitation. So the orthopaedic block is normally only about 6 or 8 weeks. So that we've got time then for all of the rehab afterwards. So we've got a brilliant team of therapists who do that. But I tend to go at the beginning of the orthopaedic block to get it up and running. And then we have a kind of tag team where we have other people then come along to do the rest of it. Well, that's just pointing out the countries in case you didn't know where they were. So, I mean, for me, it's just a huge privilege, actually, to work for this charity. And I come back slightly exhausted, but also weirdly invigorated, which I think is good for me, and I think is good for the NHS, actually. And I guess, you know, the thing that really keeps me coming back is, well, obviously it's straightening legs, but it's also just seeing smiles like this. And, you know, we always find that when the ward is kind of empty when I start, and then gradually it fills up over the sort of first week. And by the second week, the kids all come in really kind of nervous, obviously, because they're about to have a big operation and they're in an alien world that is just very strange to them. But after about 2 weeks, the ward is absolutely buzzing. The kids have all made friends with each other. The parents have all made friends with each other. The nurses, you know, just kind of playing with it. I mean, looking after the kids, but playing with them as well. And then there's this thing where every evening there's this kind of dance where the adult patients will come, they stick on some music, and they come dancing down the corridor, you know, with their catheter bags and their drip stands and their whatever else they're attached to. And there's just this kind of African dancing and African music, and they're all kind of singing and dancing along, and they come down the corridor, and then they come through the kids' ward, because of course the kids are all in bed because they had leg surgery, so they can't do this until they're a little bit further on, and then they get stuck in a wheelchair, and then they join in as well. And it's just absolutely fantastic. I go down into the wards in the evening just to see this spectacle. It's absolutely amazing. We do have time for fun on the ship. This is Crazy Scrubs Friday. So every Friday you have to find a set of really outlandish colourful scrubs. And this is Ice Cream Thursday, where after there's a whole ship meeting on a Thursday evening, and afterwards a different team from the ship will serve everybody with ice cream. And this was the day that the theatre nurses served ice cream, and they used various surgical implements to do it. And this was the Mercy Olympics, so this was when the Olympics was on, and we had a whole ship one Saturday kind of doing various sporting activities. There's a tiny pool on board for the staff on the top deck, but you can pretty much push off from one end and land at the other end, so it's that small. But there was badminton and all sorts of other things. Let's get back to this question: what's poverty? Anybody want to shout out what they think poverty is? Actually, let's take that slide off. What's poverty?
Constantly having to think about the basics of life.
Yes. Yeah. Basics being food, shelter, clothing. Anything else? Any other thoughts?
I think it would be a loss of the sense of any resilience. You're always on the defence.
Yeah.
Rather than on the offence.
Yeah. Yeah, you've got no buffer, have you, to... Yeah. So when the World Bank asked this question of people from low and middle income countries, these were the kinds of statements that people came out with. So for the poor person, everything is terrible: illness, humiliation, shame. We are afraid of everything. We depend on everyone. No one needs us. We are like garbage that everyone wants to get rid of. I feel ashamed standing before my children when I have nothing to help feed the family. I am not well when I'm unemployed. It's terrible. During the past 2 years, we have not celebrated any holidays with others. We cannot afford to invite anyone to our house, and we feel uncomfortable visiting others without bringing a present. The lack of contact leaves one depressed, creates a constant feeling of unhappiness and a sense of low self-esteem. When one is poor, she has no say in public. She feels inferior. The poor have a feeling of powerlessness and an inability to make themselves heard. So I liked your answers. Usually when you ask this question, actually what you find is that people who are materially poor focus on the psychological and the social impacts of that. And people who are materially not poor, i.e. us, tend to focus on the lack of material things when you ask them. I'm going to just flick very quickly actually to another slide that I hadn't meant to put in, which is this one, because the question is what do you do about it? And I think the answer lies somewhere in empowering people. And rather than an organisation turn up and say, I think I know what you need, we're going to do this, you need to really partner with people and see what they want and actually work with them and work alongside them, so that you're just empowering them. And this just shows, the kind of the coercion. Local people submit predetermined plans developed by outsiders, and that's a kind of doing to relationship. What you really want to get to is the responding to, with local people setting their own agenda to mobilise and carry it out without outside initiators and facilitators. I would say Mercy Ships is somewhere in this green, because we very much partner with. There's this whole kind of legal agreement that gets written before the ship arrives with the government, where there's a lot of discussion about what they want and what they need. Obviously, that doesn't always marry up with what Mercy Ships can provide. So there was a country recently that wanted us to train GPs to become surgeons in 3 months. So you kind of have to explain that's not really what we can do. But, you know, after that kind of negotiation, hopefully we, you know, have a really good partnership where they feel empowered rather than just being done to. You've seen all the rest of my slides now. Right, let's tell you about Sambani. So he had his operation. His wife and children didn't recognize him when he finally went home. Where do you think his blood came from?
His family.
The staff, yeah. So the crew are the walking blood bank. And anybody who's in the crew can go and you know, have their blood tested, and then if it's known that you need a certain blood group or whatever, they'll put out a call over the tannoy, and people will just go down and donate blood. There's a picture apparently of him. I couldn't find it, but somewhere on the internet there's a picture of him surrounded by 10 people who are all the people who donated blood to him for his surgery. This is what Mandela said about mercy ships. So, if you'd like to know more, please follow us on social media if you're into that kind of thing. I would really highly recommend this book. This is by Don Stevens, who was the founder of Mercy Ships. It's really readable, it's really interesting, and it's quite a kind of gripping read actually. But it's about the whole kind of start, the beginning of Mercy Ships, which began in, when did you say it began?
1978.
1978, yes, I knew it was about that old. So it has been going, it's been going quite a long time. Yeah, I always kind of feel if you imagine what you would want a church to be like, that's what Mercy Ships is. Completely welcoming of everybody and working together for a common purpose to actually, you know, to love and to serve people. And so many of the Mercy Ships patients will say afterwards, my healing started the moment I stepped on board the ship. And they say things like, for the first time I felt seen, and for the first time somebody touched me, you know, that because they've often been just ostracized. Thank you very much for listening.
Let's take a few questions if people have.
Yeah, absolutely. Yeah.
What a fantastic talk. I knew it would be interesting and moving, and it certainly was. Any questions for Rachel? Eric?
So for the children who've had surgery, what happens as they grow? Do they need further surgery or anything? Or is everything just normal when they grow?
Yeah, I mean, hopefully not, and this is why we fill them up with vitamin D and calcium and things. And that's why with the Blount's kids, you know, we try to stop it getting worse by taking out the physis on the lateral side. So yeah, we can't guarantee they're not going to revert a little bit, and some of them do. Because we're tending now to go back to a country either twice or 3 times in a row, which is why I've been to Sierra Leone 3 times and Senegal 3 times and Madagascar twice, and I'm going back again next summer, which has given us the opportunity of doing some follow-ups, at least for sort of 2-year follow-ups, which is helpful. But these are tried and tested techniques that are used in land-based hospitals as well, and certainly we hope that they wouldn't go back to where they started from.
Jane?
I just wanted to ask how this is all funded.
Charitable donations.
It's purely charity.
Yes. So sometimes our government does a matching scheme. So they'll have a period of time where they say, whatever you raise, we will match it. And obviously, we have a UK office. A number of countries all around the world have their own Mercy Ships offices. The actual headquarters is in Texas, the main headquarters. But all of those offices are doing fundraising events all the time. So yeah, donations And we are building a new ship at the moment to replace the Africa Mercy, which is a little bit on her last legs. So you can imagine that's, you know, millions.
And it's clearly feasible to build operating theatres on ship, and it's sterile.
Yeah.
And what's your infection rate like and things like that?
Yeah, I mean, really low. It's like here, really. You know, the equipment is what I would want in an NHS hospital, and actually on the Global Mercy, it's all a lot newer than what I've got here. So it's very much, you know, Western.
Thank you for such an encouraging and inspiring talk. I've got two questions. The first is, with so much need and the story about the taxi and walking for 2 days, who decides, or how is that decided, who gets care?
Yeah.
The second one was, it's great in terms of the partnership you mentioned in training up local surgeons and meeting with the government. But what happens to local facilities when the Mercy ship is docked for 10 months? Do some people still go and receive local care?
Yeah, all both really, really important questions. So in terms of choosing patients, the selection team goes out ahead of time. They partner with local healthcare facilities. They will go from one region to another and have kind of days of patient selection. These posters go out with pictures of the conditions that we treat, so that it's sort of advertised. It's sometimes advertised over the local radio, etc. But not all patients are suitable, and they know how many we can take. So I will say to them, well, I can operate on 2 children a day, so they work out how many we can do in that orthopaedic block, and they'll go from region to region, and once they've got enough, they'll stop. So, because what we don't want to do is disappoint too many people, but inevitably some will be disappointed because they'll have a condition that is not treatable. And when I go on board, I spend my first day doing patient screening. So I see all of the patients that I'm going to operate on for the next 2 weeks. And there are usually 1 or 2 of those that are not suitable for one reason or another. And in fact, what we do is, rather than us tell them, we have a conversation with them, and I'll say something like, well, this is a really difficult problem to deal with because X, Y, and Z. And actually, maybe we need to get another X-ray, or whatever. But I'll have the initial conversation with them, and then we'll have a discussion. And if we decide that that is not something we should take on, then one of our hospital chaplains, who is African, not necessarily, ideally from the country that we're in, but it doesn't always work out. But at least they will tell them in a culturally appropriate way that we can't do their surgery, because the way you break bad news is really important. And so me coming in from another kind of Western culture, I might think I'm doing it really sensitively, but it might not be. So bad news is broken by the hospital chaplains, which is helpful, actually. But yeah, we try not to invite more people than we can operate on. And then your second question was about what happens when the ship leaves. Yes, we train surgeons, which is brilliant, but if the country doesn't have the infrastructure to allow them to do that kind of surgery, then how useful is it? And they don't always, obviously, we've been back to, I think we've been 11 times to Sierra Leone, for donkey's years. So there's still a need. But Sierra Leone now has a women's hospital that does obstetric fistulas because Mercy Ship set it up. So when we go back now, we don't provide that service because they don't need it anymore, because they've got their own. So there are clear examples there of where actually, we have set things up that have then carried on and lasted. And, we can go back and just do a little bit more training with them or whatever, just to make sure things are, continuing as we want them to. I didn't mention anything about club feet. We treat club feet as well. We have a whole Ponseti service to do that, and that is very much training local people, and there they really do, because they come and they're mentored for 10 months in casting these little babies' feet. So that then does carry on often very successfully. So it is a bit hit and miss. You know, not everything is wonderful, and you try some projects and they don't always work, but we keep trying. It's better to try than not try. Yeah.
Jonathan.
So many of these illnesses would be associated with quite a large social stigma, I would imagine. Does that,
Yeah.
I mean, does that remain at all when people return to the community? Is that a problem?
Yeah, so again, they're often taken back to the community by the hospital chaplains for that reason. So they will take them back to the local village chief or whoever and try just to talk to them to try and reintegrate them. But we do have problems with people thinking that they've been cursed, or there are all sorts of interesting beliefs. And again, our hospital chaplains will work with them to try and kind of talk through some of those issues as well. So yeah, we do our best to try and get people properly reintegrated and reaccepted into society. Yeah. Oh.
Thanks very much. Fantastic talk. Can you tell a little bit more about the prehabilitation and how important that is?
Yes. I mean, it's different for different specialties, but for us, it's around the education really of what they need to be eating, because they don't, if you don't know that just eating rice 3 times a day is not very good for you, and you're prioritizing having a mobile phone because that's how you're going to run your business and make some money, then they don't know that unless you provide that education. So we provide that education at patient selection, and they're given the right nutrition. And I always ask patients when I see them on my screening day, what can you remember of what you've been told? And they rattle off all these foods because they're given a picture of different foods, locally accessible foods that are hopefully not too expensive, that they can get, and they know them all. And the number who will say to me, oh yes, the pain has improved since we improved the diet, which is brilliant. So the message is getting through. But I'm trying to get that message through more because we do a little bit of obstetrics training. So I've had a chat with our head of education and training, who kind of organises that side of things, to say we need to get this message out to pregnant mums. We need to train the local midwives to train mothers what foods they need to be eating, and not just for orthopaedics but for other conditions as well. What we don't do is much sort of actual strengthening type stuff. And it's interesting because in the UK, if you stuck somebody in plaster for the length of time they're in cast, their legs would wither and the cast would get really big and loose. And on Mercy ships, they get too tight because the kids put on weight, sometimes more than you want them to, but they're also just made to keep walking because that's the way to get their osteotomies to compress so that they'll heal, and they heal quicker that way. But they're also getting better food than they have had. Yeah.
You spoke about your wonderful pediatrics orthopedic service. Well, is there one for adults? And so is it more for trauma?
Yeah. So I said there's a lot we don't do. We don't now do any adult orthopedics, and the reason for that was the infection rate was a bit high. And the bone healing can sometimes be a bit too slow for the period of time that we're there. So we don't do adult orthopedics, but we do adults in everything else. All of the other specialties do both adults and children, but for orthopedics it's just kids. And actually there are so many of these kids to treat that there's enough for us to do really. So yeah, we don't do adults at the moment. I think that needs to be on a land-based hospital probably.
And given the current state of NHS, when is Mr. Ship coming to the UK?
Yeah. Do you know, I get asked that quite often. Yeah, we could do with it. It's so it runs efficiently. It's a bit of a breath of fresh air, I have to say.
Actually, you mentioned a school on board the ship. Is the school for the children, the patients, or is the school for the family members of the people who go and work there?
The school is for the crew children. Yeah. Yes. That is something we are now addressing in terms of education for the patients, because it has just dawned on me a couple of years ago that we have these patients for weeks and they're often behind in their schooling anyway, and this is our golden opportunity to improve their education. So we have done a pilot study doing a whole kind of education program at the Hope Centre for them, and so I am talking to lots of people about actually we really need to roll this out and do it as a proper official thing. And it's not difficult, because actually all you need to do is employ a local teacher. You don't even need to get a Mercyship's volunteer. You need a couple of local teachers who we would pay, because local people get paid. And actually once we've got that up and running, we need to do something similar for the adults, and do, I don't know, some courses on micro businesses, or whatever they might find useful, adult literacy, whatever. So that's something that is really on my heart. Is to.
I'm also interested to know that the volunteer professionals that go out there to work, they bring their families.
Yeah.
And how long
if they're there long term, yes. So I mean, if you just come for a couple of weeks, then no. But we get people who volunteer for 2 years, a year, 2 years, 30 years. So they will bring their kids.
Speaking as a paediatrician who's worked with many surgeons over the years, do you have a paediatric physician on
We have a physician. So we have hospital physicians. There's normally minimum of 2 on board. They might be paediatric, they might not be, but they kind of have to do a bit of everything. Yeah. So they're brilliant, because they'll come on the ward rounds with us and sort out the malaria and the the whatever else crops up.
In that area, in those areas, that you wouldn't have a whole raft of other medical problems.
Yeah, exactly. So there's scope for physicians to volunteer as well.
And is there a community loan program active in many of these countries? Because this is something that's been found to be very powerful, as small amounts of money managed within local communities, particularly managed by the women, to make things work better for them, and then they recycle the money. Is that something in programs you've seen?
I don't think that's something that Mercyships particularly gets involved in, unless there's some kind of, it's very much there as a medical provision, I suppose, rather than, encouraging business or whatever. I mean, that being said, they also have a program on sustainable farming. So they do go out and talk to farmers about climate change and how you can farm sustainably and in a way that's
If only we knew how.
Yeah, exactly. Yeah.
Really inspirational. Thank you so much. Jane was going to propose a couple of thanks.
So on behalf of the President and all the members of MEDCO, I would just like to thank you very, very much indeed for a fantastic lecture. It was very inspirational. I found it incredibly emotional. I don't know if anybody else. In fact, I think probably had to retrain as a surgeon, so I can. But I think just reflecting, I think it is a win-win, isn't it? Well, professionally, you go out there and you're exposed to all sorts of really complex conditions which you wouldn't get experience with, certainly in this country. So from that point of view, it must be fantastic. Also, obviously, the patients themselves benefit so much, so there must be so much reward. Yeah. Fantastic.
It's great. It's a safe way of volunteering as well. We were going to hear from somebody who went to Tanzania, weren't we? And actually, just turning up in a place and doing something can be quite daunting. Whereas with Mercyships, absolutely, that's your next talk, isn't it? But you're very looked after as a Mercyshipper.
So thank you very much.
Yeah, thank you.
Keep doing what you do.
Thank you. Thank you for inviting me.